In this TV6 Investigates, we're continuing to look at how the availability of inpatient mental health care in the UP measures up to the need. Last night, TV6's Julia Seitz told us it's not just a shortage of inpatient beds, but resources after treatment ends that limits availability. Tonight, Julia joins us again to take a look at the gap between insurance and necessary treatment. Julia?
Thank you, Brady. That's right. Providers tell me it's a race for inpatient psychiatric treatment in Michigan. In part 2 of this two-part TV6 Investigates, I share how coverage impacts the competition for beds.
North Point Behavioral Health Services CEO Mandy Paget says your insurance can determine if a private or state-owned hospital will take you in. She says private hospitals may refuse a patient if they're too severe because they're not a good fit for the program. Meanwhile, state-controlled hospitals will take Medicaid patients, but she says that's typically only during dire circumstances, a challenge for community mental health service programs like North Point.
The meager amount of beds that we do have available, we have to compete with each other, right? We have to compete with the other CMHs in the Upper Peninsula and frankly, the other CMHs throughout the state of Michigan to see who can grab the bed the quickest, essentially, and then whether or not those providers will even take the people that we serve is a whole nother conversation.
Regarding admission, UPHS Marquette Market CEO Tanya Darner says in a statement that the hospital accepts Medicaid for inpatient behavioral health services that are medically necessary, saying, coverage, including the length of stay, is guided by Medicaid policies and the specific needs of each patient. Our care team works closely with insurance providers to help ensure patients get timely access to inpatient care and smooth transitions to follow-up services in the community. For individuals without Medicaid or no provider, Paget says they can use North Point's general fund. The fund receives about $1 million per year to help people with hospitalization costs. However, she says the funds don't get far when North Point serves hundreds.
Some bed placements are over $1,000 a day. So when you think about $1 million and you think about, 10, 15, 20 people who maybe need, 10, 15, 20 days apiece, the dollars go very, very quickly.
This is one of North Point's rooms where patients undergo casework or outpatient therapy. However, she says preemptive care can only do so much when there are people who still need inpatient care.
Paget says the Michigan Medicaid Manual or North Point's mental health code criteria cover inpatient treatment for people with severe illnesses. She says those who don't meet these criteria, like mild to moderate illnesses like major depressive disorder, often fall through the cracks.
Those people are people who we often see presenting at the hospital in a psychiatric emergency. And so they end up in the system somehow anyhow, but because of the constraints on who we can see and who we can't, we have an inability to serve them in a proactive, preventative way. And so then they end up in the hospital and then the cycle starts.
Still, health professionals and legislators are working to break that cycle. For example, in 2023, Michigan joined the Psychology Interjurisdictional Compact. It allows licensed psychologists to practice telepsychology and the temporary in-person face-to-face practice of psychology across state boundaries. According to PsyPact, the agreement supports patients in undeserved areas like the UP. As for bed availability, Paget says Michigan still needs to bring all stakeholders to the table.
We need to bring the state of Michigan to the table. We need to bring the community mental health service providers, key stakeholders, and have an honest and robust dialogue about what needs to happen to provide support to people where they need it, which is in their own communities.
Paget also urged residents of the UP to get in touch with lawmakers and ask them to seek solutions. Meanwhile, providers continue to focus on preventive care, such as the MDHHS's Behavioral Health Home Program. It offers Medicaid beneficiaries patient-centered care to increase access and reduce unnecessary hospital visits. Brady?
Thank you, Julia. And if you want to see more stories from TV6 Investigates, you can watch them on demand. You can find all our previous stories by clicking on the TV6 Investigates tab on uppermichigansource.com or find the category on our free TV6 Plus streaming app.